Welcome to Health Matters on Channels Television. We're so glad you could join us. I am Mary Alale Yusuf. Nigeria has reported her first case of COVID-19, an Italian national who came into the country for business. The man tested positive on Wednesday, February 27th, while in Nigeria, he is being treated at the Infectious Diseases Hospital at Yaba. So far, almost 84,000 people have been infected in 53 countries. Most infections are in China, but the virus is spreading more rapidly outside China. The number of new cases in China keeps dropping. This week recorded the lowest yet. As of Friday, newest cases were linked to Italy. The World Health Organization has ranked the risk of the spread very high at global level. 36,000 plus individuals have recovered from COVID-19. My guest is a consultant epidemiologist and chairman, Lagos State Primary Healthcare Board. He's also the former chief medical director of LUTH, Professor Akin Osibogun. You're welcome to the show, sir.
Good afternoon, Mary.
Let's start with our own case. That's what's on everybody's hearts in Nigeria now. He came in from Milan, passed through Turkey, got to Lagos, went to Ogun State, and was brought back to Lagos. What is contact tracing going to look like for this individual?
Thank you very much. For any such case, what we need to first do is to start a line listing of all contacts. So that means we'll have to start from the manifest, the plane that brought him into Nigeria. The plane came in through Istanbul, and we're already on that, So we get a line listing of all the passengers, particularly those who were in the same cabin with him, and then we contact them, and then we follow them up. Then, of course, at the airport, we also need to get a line listing of all those officials, immigration, customs, and the people who received him at the airport, the vehicle driver who took him from the airport to the hotel, the workers at the hotel. We've already identified all those spots. And as I speak with you now, Lagos State government officials are already all over the place trying to follow up on all those contacts. Of course, in Ogun State at Ewekoro, where he went, the company has already identified all the direct contacts, the people he held meetings with, and I have information that they've already been safely isolated, and they'll be followed up by the Ogun State Ministry of Health officials and other health officials. And of course, it had to be brought back to Lagos because of the facilities we have in Lagos, because we've started preparing for this, because we all knew that it was just a question of time. And the WHO had warned that it was coming, not particularly to Nigeria. The WHO had warned all countries.
Spread.
Yes, had warned all countries.
But let's talk about those facilities. Are they up to international standards, would you say? Is it something you'd be proud to show the world?
What I can tell you is that science is constant. So when people talk about international standards, science is the same in Lagos and is the same everywhere. But of course, you can have a Lamborghini car and you can have a Volkswagen car. The science is the same, but then there can be upgrades, if I can put it that way. So to the best of the ability of the Lagos State government, adequate resources have been deployed to ensure. And we started planning because the outbreak was in December, so we started planning immediately. So we anticipate. Unfortunately for us, based on our experience about the Ebola virus disease outbreak of 2014, that had actually informed the Lagos State government to plan ahead. So we already have advanced diagnostic capabilities in Lagos. So in 2014, it took us 3 days to make the diagnosis of Ebola virus disease. In 2020, it took us 4 hours to make the diagnosis of this coronavirus. Just to tell you.
So things are getting better.
Things are getting a lot better.
Would you address the rumors that, have started going around that the COVID-19 patient tried to escape because he didn't like the conditions?
Well, I will tell you, there's no sick person who likes the condition of being sick.
Well, complaining of heat, mosquitoes and all that.
There's no sick person. Naturally, infection with the virus will elevate your temperature. That's one of the signs and symptoms. But it's been well taken care of, I can assure you. The facilities in which he is adequate for the purposes of our managing him. And I was there last night. I didn't see the patient.
Okay.
Yeah, but
I'm not scared.
Yes.
I'll wash my hands.
Yes.
All right, but in this same center, we have other infectious diseases. There's tuberculosis, there's HIV, and other things. Are they planning to relocate these other people?
They're in
because
different
right
wards.
now they are immunocompromised.
They're in different wards. They're in different wards. They are not exactly in the same ward.
Okay.
We have a special ward that the Lagos State government started investing on in the past couple of months. And this isolation ward is generic, not necessarily specific for coronavirus, but we anticipated that epidemics will always come. So, and in Lagos State now, we've established the Biosecurity Council, to anticipate any future epidemic and to be planning ahead of such epidemics.
So everybody is safe?
To the best of our capability.
They are separated enough that they won't
well
get
separated.
infections.
No, they are
from
not.
each other.
They are in separate places entirely, although within the same hospital.
Okay. There's something I'd like you to address. People are not that educated and also not so medically, aware. This infection it's said that it is spread by droplets, but it is not airborne. Now, some people are confused. Don't the droplets pass through the air? Can you differentiate for us the meaning?
Well, I think for the purposes of the general public, I'll just say that respiratory infections are transmitted via air. Now, the particles that come out are of different sizes.
Okay.
So droplet infections are larger in size. That's the distinction that people who talk about droplet and airborne.
Okay, because it's an actual fluid.
Yes. So because they are larger in size, therefore they can't travel long distances.
Okay.
So if you maintain about 2 meters or 3 meters from an infected person, it is not likely that that droplet, because of its weight, will be able to get across to you. That's the distinction people are trying to make. The other side of it is that because it's a droplet infection, it means that the virus can be in the inner core of the fluid.
Okay.
So it can be in the inner core. And because it's in the inner core of the fluid, it means that if that droplet drops on a table, that virus can survive for some 3 to 5 days. We don't know yet because it's a new virus, but the information we have as of today suggests that it can survive, some say 3 days, some say 5 days. But the information is evolving because it's a new virus. Unlike other airborne particles that are lighter in weight, which can travel far distances, that's why that distinction is being made, to tell us that it can be both transmitted by droplets and it can also be transmitted by contact.
Okay.
Because
if you maintain your distance,
yes,
you should be safe.
You should be safe, but if the droplet is already on the table, because it's in the core of a fluid, the virus is still surviving, and you place your hand on the table, you can actually
touch your face after.
Touch your face. Aha. That's why we're advocating regular hand washing and then minimize hand-to-face movements.
Talking about time and periods, initially we were told that this virus has an incubation period 3 days to 14 days. But the numbers keep changing. Some say 1 day. Has it not been determined really how long this virus incubates for before symptoms start to show?
As I mentioned earlier on, this particular epidemic started December 2019, and it's a new virus. So the science and the information will be evolving. nothing is final for now. Research will continue. The only thing I can tell you is that we've been able to decode the genome, and because we've been able to decode the genome, so we have a full picture of the genetic materials of the virus. That's an advantage. I would say that would be one of the key things we've been able to rapidly achieve. I mean, the scientific world.
Okay. What advantages exactly does it give you?
Yeah, it helps us in the speed towards discovering a vaccine. It helps us in the speed towards discovering treatment modalities. I'm not saying it's going to happen next week, though. I'm not saying it's going to happen next week, but it helps us in that speed once we know the characteristics of the genetic properties of the virus. But because it's a new virus, a lot of information is just being gathered about it.
Yes, pieces of information are just coming together. Let's quickly take a break. We'll take a break right now and come back shortly. Stay with us. Welcome back. This is Health Matters, and we're discussing COVID-19. To ask questions, call 0808 054 2233. That's 0808 054 2233. You can also tweet at CTV_Mary A for your questions. Right now, we're moving freely, generally, in Lagos, in Nigeria, and we hope it stays that way. But at what point does it become necessary to begin to lock down cities and towns?
Well, based on our hopes and because we anticipated, based on our level of preparedness, we are hoping that we'll be able to contain this. And that containment will be based on identifying all those direct contacts and ensuring that we follow them up for the next 14 or 2 to 3 weeks. So if we're able to do that successfully, as we did in 2014, then there may be no need to escalate any further action. The only problem will be when you then start having multiple cases, and that's why we are not sleeping for now.
Can you say between yesterday and today that the patient has improved?
Oh, the patient has improved. The patient, remember, I'm also a physician, so from all the information that I got as at last night, late last night, from those who are directly managing him, the patient is already on his way to recovery. He's doing very well.
Some people, this patient didn't come down with respiratory symptoms. He just had temperature and body pains. But others come down with respiratory symptoms. Some get bad really fast. Is there any determinant for what kind of symptoms a person does or does not get?
Those are the things we are now trying to document because it's a new virus. We are now documenting all the various ways of presentation. So nobody can say with a finality that this is exactly how it should present. But based on the data that are being collated now from China and from other places, we'll be able, in the next couple of days or weeks, will be clearer as to the characteristics of this virus. Yes.
Let's quickly take this call from Francis. Hello, Francis.
Hello, how are you, madam?
Very fine. What's your question?
My question is this same virus, coronavirus or COVID-19, we understand it has no cure for the moment. And a lot of people were exposed to this same virus. And I understand like 36,000, are already survivors of this disease. How come it kills some people very fast and some others it does not?
So much, Francis. I'm sure the prof will be able to answer this question.
Oh, definitely. The virus, like any other microbial invasion of man, will be able to multiply and then cause damage. But that ability to multiply and cause damage is dependent on the host's resistance, the immune status. Does that person have some underlying conditions? If the person's immune status is sufficiently high, it may be able to resist. And then the other thing, of course, is what kind of health assistance has that person been able to receive? Because at
And how
times,
soon?
and how soon, yes. Because of the increased temperature, the fever, there will tend to be a lot of dehydration. And once there's dehydration, it will then start affecting the kidney. The kidneys then start shutting down. But if anybody who is undergoing or observing some of the symptoms gets to the health center or health facilities on time, then that person will be monitored and will be rehydrated appropriately, and all the other supportive treatment provided. And that person's chances of surviving is very, very high.
That brings me to something else some people are saying. They are saying before you even get sick, even if you don't ever get sick, to boost your immunity, you should drink water like 15 minutes. Every 15 minutes, drink some water, to boost your immunity. I know it sounds really odd, but and then
Yes.
wash your hands as often as possible.
Wash your hands as often as possible because of the contact nature of the transmission, because as I mentioned earlier on, it can be on surfaces and it can be contact infection. So washing your hand is very important, but maintaining a good level of hydration is also very important.
But
because
perhaps not every 15 minutes.
No, not every. Well, that becomes fanatic.
Okay.
Yes.
How many labs do we have around the nation for this? Because this person who got sick was detected in Ogun State, but had to be brought to Lagos. So where can we actually
that
do
should
these
not be a
things?
problem. These specialized labs cannot be in every corner.
Definitely.
The National Center for Disease Control has what we refer to as a network of reference laboratories. And in most countries, it may be sufficient to just have them in 6 geopolitical zones. So you have one in maybe the northeast, one in the northwest, north central, southeast, south, and then
Okay,
of
but
course,
we'll come back to
southwest.
that. We're having a call from Lukman. It appears we've lost Lukman. We'll wait for another call. So, but that doesn't really answer the question about where exactly.
Yeah, I just answered the
labs.
question. So the National Center for Disease Control has a network of these specialized laboratories spread over the country, and you don't need more than 6 of them. Because what we need to do, what we're doing presently in Lagos, when it happened in Ogun State, you bring the patients and people are trained. So it's not everybody that can take specimen from these specialized patients, if I can use that word.
Okay, so people are asked, in the general instructions about this disease. They say that if you're having symptoms, if you're coughing, you have body pains, you have a fever, you should self-isolate. You should stay at home. Now, if he's at home, how does he get to the hospital if it becomes more serious?
Okay, so in Lagos State, we've provided telephone contacts. So you stay at home, and if you then get serious, then you make a call.
Okay. Let me quickly cut in there and quickly take this call. Hello?
Hello, this is Douglas Johnson.
Johnson, what's your question?
Okay. Hello. Good morning.
Good afternoon. We can hear you.
Yeah, my question based on this COVID-19, which we have really find out that is here with us in Lagos now. Can you hear me clearly?
We can.
Okay. Now, this case of this Italian that just got into Lagos and traveled to Ogun State, and then, so my question now is, what measures have the government put in place, especially at our airports, to trace those who come in, at least to get them screened and monitor them, especially from countries that have been highly infected by this coronavirus?
Thank you so much, Johnson.
So, yeah, very good question. Thank you for the question. What the government has done is to screen all incoming passengers, and the screening is through, one, a self-administered questionnaire. So we expect people to answer the questions honestly. And there are questions about whether you've had fever, you have symptoms of the virus or you have any other illness. So the questionnaire addresses that, but it depends on the integrity of the passengers. And then, of course, at the airports, you also have thermosensors. You see, because that's another area where people assume nothing is happening. Previously, we had handheld infrared thermometers that had to be pointed at people's bodies. But now you have thermosensors that are just static, and everybody passing by,
it detects the temperature. Okay, that's why people are saying nothing is being done at the airport.
Yes.
Okay, well, that's a step up.
Oh, yeah. So you have thermosensors, and as you are walking past, somebody is sitting down behind what appears to be a computer or a laptop, and is looking at the screen. Anybody passing through that corridor and as an elevated temperature will be shown in red on the screen, and then the person monitoring on the computer will then draw the attention of health officials to that person, and that person will be pulled aside for further screening and investigation.
But then, of course, somebody who is infected might not be showing a temperature,
of course,
right?
Yes. So the alternative is then to shut down your country, to say nobody travels. But the WHO has not recommended a travel ban.
Thank you so much for coming to the show, Prof. I've enjoyed myself so much, I hardly saw the time go by.
Wow.
And I'm really grateful for your presence here. I know that you're very busy with this COVID-19. So thank you so much. Thank you, all of you at home. And thanks for calling Francis, Johnson, Lukman. Have a wonderful day and stay safe. I am Mary Alale Yusuf.